How does cervical dysplasia relate to cervical cancer symptoms? Imagine a tiny change happening in your cervix that could be a warning sign of something more serious. That's what cervical dysplasia is. It involves abnormal cells in the cervix that are not yet cancer but could become cancerous over time. These abnormal cells are classified into different levels based on how severe they are. Mild dysplasia, or SIN-I, involves slight changes, while severe dysplasia, or SIN-triple, shows more significant abnormality. The key point is that dysplasia itself is not cancer. It's a precancerous condition, meaning it has the potential to develop into cancer if left untreated. One of the tricky parts about cervical dysplasia is that it usually doesn't cause any symptoms. That's why regular screening with Pap tests is so important. During a Pap test, a healthcare provider gently collects cells from your cervix to check for abnormalities. If abnormal cells are found, further tests like HPV testing or a biopsy are often recommended to determine the severity. Most cases of mild dysplasia resolve on their own without treatment, but high-grade dysplasia needs closer attention because it carries a higher risk of progressing to cervical cancer. When symptoms do appear, they often mean the disease has advanced. The most common symptom linked to cervical cancer is abnormal vaginal bleeding. This could be bleeding between periods, after sexual intercourse, or after menopause. Some women notice heavier or longer periods. As the disease progresses, other symptoms may develop. These include watery or bloody vaginal discharge that might have a foul smell, pain during sex, or pelvic pain. In more advanced stages, women might experience lower back pain, leg swelling, or unexplained weight loss. These symptoms are signs that the cancer may have spread beyond the cervix. The connection between cervical dysplasia and symptoms of cervical cancer highlights why screening is so vital. Since dysplasia usually doesn't cause symptoms, catching it early through regular Pap tests can prevent it from developing into cancer. If abnormal cells are detected early, doctors can treat them before symptoms or more serious disease appear. This early intervention is key to preventing the progression to invasive cancer. The main cause of cervical dysplasia is infection with high-risk types of human papillomavirus, or HPV. This virus spreads through skin-to-skin contact during sexual activity. Most sexually active women will encounter HPV at some point, but in most cases, the immune system clears the infection naturally. However, persistent infection with high-risk HPV types can lead to abnormal cell growth and eventually dysplasia. That's why HPV testing is an important part of screening, especially for women over 30. The good news is that treating cervical dysplasia is highly effective in preventing cervical cancer. Many cases of mild dysplasia resolve without intervention, but for more severe or persistent cases, procedures like cryotherapy or laser treatment can remove abnormal cells. Regular screening and follow-up ensure that any abnormal changes are caught early and managed properly. Remember, absence of symptoms doesn't mean absence of disease. That's why routine checkups are your best defense. In summary, cervical dysplasia is a precancerous condition that often doesn't cause symptoms. When symptoms do appear, they usually indicate that the disease has advanced into cervical cancer. Regular screening helps detect dysplasia early, allowing for treatment before symptoms or invasive cancer develop. Always consult your healthcare provider for personalized advice and screening recommendations to stay ahead of potential issues.